CPT JJ-CPB Evaluation and Management Services Guidelines, page 4, part 11. New and established patients continued, right? Then we're reading.
Okay. And then no distinction is made between new and established patients in the emergency department.
Right. The rules for cataloging a new or established patient in the emergency department are the same as in a visit to a doctor's office. Okay, so the same criteria applies here. So E&M services in the emergency department category may be reported for any new or established patient who presents for treatment in the emergency department. So the categorization is exactly the same, right?
Mm-hmm.
The decision tree.
The decision tree is provided to aid in determining whether to report the emergency management evaluation and management service provided as a new or an established patient encounter.
And if you see the decision tree is exactly the same as the one we have for a doctor's office. It's 3 years seen by the same doctor or a member of the group, right? And the same specialty and the same subspecialty. If you answer yes to all of those questions or yes to any of those questions, right? You're an established patient. If not, you're a new patient. Okay, so that's our theory for today. Now let's do a problem. So ready, set, go. Okay, the title for problem is CPT JJ-RVA-266, page, the page is 266, the exercise is 132, and it's a level 1 exercise, and the title is?
Nerve block.
Nerve block, right? So the text reads like this.
Surgery, nervous system.
Mm-hmm.
Patient has right sacroiliac joint dysfunction and requires a right sacro 2 through sacro 3 paravertebral-facet joint and aesthetic nerve block with image guidance.
With image guidance, okay? So that is the procedure, okay? So we are going to count to 3, so you can stop the video or you can pause the video and then give us the answer to this procedure, the CPT code for these procedures, okay? So 1, 2, 3. Okay, the answer is 64493. Did you get that? If you got it, congratulations. You can go to the next video. If you didn't get it, let's give you a few tips. First tip.
Start with nerve block, see injection.
Okay, you go to the index and you start with the main procedure, which is a nerve block. You're going to block the effect of a nerve, so it's a nerve block, right? And then from then you're going to go to which part of the body you're blocking the nerve, right? And in that, it's good to know that.
Note that sacral is included in sacroiliac.
Sacroiliac, right? So sacral, if you see sacral or sacroiliac is the same thing. The sacral is just referring to one part of the junction, but the sacroiliac, they come together. So both things are the same thing, right?
Right.
Now, we have links to understand this procedure. The main 2 links, as usual, are the 2 A+, and A+. The first one explains a lot of the SI joint, or the sacroiliac joint, right? So click this to learn about the SI joint. And the second one is how the nerve block is done. Okay, so these 2 A+ videos are recommended, and if you have a little more time, you can read the next links. Okay, so you have the answer, you have the tips, you have the answer, and now we're going to count to 3 so you can pause the video and give us the path, how we got to the answer. Okay, so 1, 2, 3. Okay, let's read the whole summary of the problem. This is a surgery section of the CPT book, is the nervous system, and the patient has a right sacroiliac joint dysfunction, an SI joint dysfunction, and requires a right S2 and S3. Those are names of the vertebrae, right, that are in the sacroiliac part. And it's a paravertebral facet joint, an aesthetic nerve block with image guidance. That's the text of the procedure. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to nerve block.
Nerve block is the procedure, okay? That's what you're doing. You're blocking a nerve so that there won't be any pain. So that's a nerve block. Okay, when you go to nerve block, you have two choices, right?
Yes. It's either C, injection, or C, anesthetic agent.
Now, the anesthetic agent would be if you know which agent you're using, but since you don't know here, then let's choose injection, right? So you go to injection, right?
Right.
And then from then you go to?
Paravertebral facet, joint, facet, joint nerve.
Which is exactly the same wording as in the problem, paravertebral facet joint, right? And from there you go?
With image guidance.
Which image guidance is right here. Okay, so you just follow in the text of the problem, and then you get a range, right? 64,490 to 64,495, right? Now you have to go to the tabular in order to see which of these codes is the right one, right? And now when you are reading the description, you find that the difference in the codes is just which vertebrae they're talking about. The thoracic, and there's other levels, and then when you keep reading, you get to the 64,493 is the lumbar or sacral, which includes the sacroiliac, right? Which we told you already that is the same thing. So that's why you can keep reading, but you have to go back to this code, because this is the one in the sacroiliac, 64,493. That's why we go. Can you go back here?
Right.
Double.
All right.
And then we go back to 64,493, and the equal sign means that that's their code, right?
Right.
That's our code. So the answer is 64,493. Okay? So thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
yeah, right, just click on the subscribe button and you will get
up to 3 videos every day that we make. ICD-10, CPTs. All that's needed to pass the medical coding certification exams.
So don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.